Now this is the ear cleaning experiment. Would you like to hear how we do the cerebrospinal fluid punctures?
Yeah.
I can demonstrate right here on this. Viewers, we have a problem here. We are in the gold-bearing strata just over there, and we have a lot of panners. And unfortunately, these panners have developed a small epidemic of meningococcal meningitis. So today, for our continuing medical education lesson at Lost Lake, we're going to demonstrate how to retrieve cerebrospinal fluid from Andrew Fields. And what we do is we get Andrew in this position, preferably lying on his side, but bent like this. And then we put in a small amount of xylocaine, lidocaine, whatever you prefer, to anesthetize the skin. We run that in for about an inch, directly in towards the midline of his spine. Then with great dexterity, aplomb, and lots of experience, we place a 6-inch needle into his back, usually going in about 3 to 4 inches, when we feel a distinctive pop or click as it goes through the ligament surrounding the spinal canal. After that, we remove the stylet from the needle, which is hollow cord, and hopefully clear fluid drips out. But in the case of our gold panners, it's usually cloudy fluid, sometimes pus-like fluid. And if we don't treat these boys, they die rather rapidly. So Andrew, are you ready to demonstrate the actual procedure up here, or do you want to wait till you get back to the hospital?
Doctor, what are the risks first before I go into the...
Well, the risks to me are very few, so it's not a problem at all from a medical point of view. Your risks are also pretty minimal.
What kind of pressure is that spinal fluid under?
Well, it's usually
Will it hit you in the eye?
It's usually, normal is usually less than about 20 to 24. When it starts getting above that, it's elevated, and there's a cause for that. But most people run the cerebrospinal fluid pressure less than 10. Very, very low.
Is that enough to be a gusher?
It can drip pretty fast. You got to be careful. If you take too much cerebrospinal fluid out, you have the chance of mobilizing the cerebrospinal fluid in the brain area surrounding the brain, trying to all get out the small hole at the base of the skull. And when that happens, sometimes the brain also tries to get down through that little hole, and you can kill somebody rather rapidly. So you have to be careful with the amount of fluid you take out, especially if they have elevated pressure. Okay.
It will freely flow when you take that needle out, eh?
Yep. When you take the stylet out of the needle, it will flow, just drip, 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 coming right out. Looks a lot like Lost Lake down there for the folks who have meningitis. Okay, that's it. We have to move on. Thank you, viewers. Mr. Michelson, if you get this, thank you.
So you can drain the brain just like draining a drain, eh?
Something like that. Very good.
So does it go counterclockwise south of the equator and clockwise north?
Have you considered moving out of geology and becoming a neurosurgeon?